Hello everyone and welcome to today's presentation. I'm excited to have you here. Today we will be exploring Chapter 1, which focuses on certain infectious diseases categorized under codes A00 to B99. In this session, we'll cover key aspects of these diseases, including their classification, characteristics, and importance. I look forward to guiding you through this important topic. Let's get started. Let's take a moment to understand what infectious diseases are. Essentially, these are illnesses caused by pathogens, tiny organisms like bacteria, viruses, fungi, or parasites. These microorganisms have the ability to cause disease in humans. What's particularly important to remember is that infectious diseases can be transmitted from one source to another, which means they can spread easily between people, animals, or even through contaminated surfaces or food. Recognizing how these diseases are transmitted is crucial for prevention and control. Throughout this presentation, we'll explore how these pathogens spread and what measures we can take to protect ourselves and others from infection. So let's talk about how these pathogens are transmitted from one host to another. First, there's direct contact. This means physically touching an infected person or animal or coming into contact with their bodily fluids. Think about handshakes, bites, or even contact with blood or saliva. It's a very immediate way for infections to spread. Next, we have indirect contact. This involves touching surfaces or objects that have been contaminated. For example, doorknobs, utensils, or even food and water that might have the pathogen on them. Airborne droplets are also a key part of this route. Coughs and sneezes can release tiny droplets into the air, which can then be inhaled by others nearby. Finally, there's the role of vectors. These are insects or other animals that carry pathogens from one host to another. Mosquitoes, for example, can transmit diseases like malaria or dengue. Understanding these different transmission routes helps us see how infections spread, and importantly, how we can prevent them. This all ties back to the overall theme of infection control and the importance of being aware of how pathogens move around us. Bacterial infections are caused by harmful bacteria that invade our bodies, multiply, and then lead to various health problems. These bacteria can enter our body through several routes. For example, they can get in through skin breakouts, like cuts or wounds. They can also be inhaled through the air we breathe, especially if the air is contaminated. Consuming contaminated food or water is another common way bacteria can enter, which is why food safety is so important. Additionally, sexual contact can be a route for certain bacterial infections to spread. Understanding how bacteria infect us helps us better appreciate the importance of hygiene, safe practices, and early detection in preventing and controlling these diseases. This ties into the overall theme of how infections spread and what we can do to protect ourselves. Let's take a closer look at bacterial infections and see how they impact different parts of our body. Respiratory infections are quite common and include illnesses like pneumonia, tuberculosis, and bronchitis. These can affect breathing and require prompt treatment. Moving on to skin infections, we see conditions such as cellulitis, boils, impetigo, and wound infections, which often occur when bacteria invade the skin barrier. Sexually transmitted infections, or STIs, like chlamydia, gonorrhea, and syphilis, are transmitted through sexual contact and highlight the importance of prevention and early diagnosis. Gastrointestinal infections, like food poisoning and cholera, remind us how bacteria can disrupt our digestive system, leading to dehydration and other serious issues. Finally, there are other significant infections, such as urinary tract infections, meningitis, and sepsis. These can be life-threatening if not identified and treated quickly. As we see, bacterial infections can affect almost any part of the body, emphasizing their importance in our overall health and the need for effective prevention and management strategies. This connects to our broader theme of understanding infectious diseases and improving health outcomes. Viral infections are any illness you get from a virus. They are incredibly common and can affect different parts of your body. Some of the most familiar viral illnesses include colds and the flu, which we often experience during certain seasons. COVID-19, of course, has been a major concern worldwide in recent years. Norovirus is another example, often causing stomach bugs and outbreaks in places like cruise ships or schools. Then we have HPV, which is known for causing warts, and herpes simplex virus, which can lead to cold sores. These examples highlight how diverse viral infections can be, affecting everything from your respiratory system to your skin. Understanding these common viruses helps us see how widespread and varied viral infections are, and why prevention and proper hygiene are so important. They really tie into our overall theme of understanding infectious diseases and how they impact health. Today, we'll be focusing on some of the major infectious diseases that are relevant to our discussion. The first one is HIV, which remains a significant global health challenge. It's important to understand how it affects the immune system and the importance of early detection and treatment. Next, we have sepsis, a potentially life-threatening condition caused by the body's extreme response to infection. Recognizing its symptoms early can be crucial for survival. Then there's COVID-19, the pandemic that has reshaped our world over the past few years. Its impact on healthcare systems and the importance of vaccination and public health measures are key points to consider. By exploring these diseases, we can better appreciate the complexity of infectious diseases and the importance of comprehensive prevention and management strategies. Let's talk about the human immunodeficiency virus, or HIV. This virus is quite insidious because once it infects the body, it causes a condition known as immunodeficiency. Essentially, it targets and weakens the immune system, making it harder for the body to fight off infections and diseases. Understanding this process is crucial because it helps us see how HIV leads to more serious health issues if left untreated. So, in the bigger picture of our presentation, recognizing the pathophysiology of HIV is key to grasping how it impacts overall health and the importance of effective management. Let's take a closer look at the key aspects of HIV pathogenesis. First, viral replication and cell tropism. HIV primarily targets and replicates within CD4 plus T lymphocytes, which are essential for orchestrating immune responses. However, it's important to remember that HIV can also infect other immune cells, such as macrophages and dendritic cells, which can serve as reservoirs and contribute to the persistence of the virus. Next, we have mucosal tissue involvement. Early in infection, critical events occur in mucosal tissues, especially in the gastrointestinal tract. This is where we see a massive depletion of CD4 plus T cells, and this early damage plays a significant role in the progression of the disease. Finally, let's discuss immune system disruption. HIV infection severely disrupts the immune system by depleting CD4 plus T cells, which are vital for fighting off infections. Even with antiretroviral therapy, or ART, we often observe chronic immune activation and ongoing inflammation. This persistent immune activation is a hallmark of HIV infection and contributes to many of the complications seen in affected individuals. Connecting all these points, understanding how HIV interacts with immune cells, particularly at mucosal sites, and causes ongoing immune disruption, helps us appreciate the complexity of managing and ultimately aiming to control the infection. Let's look at the signs and symptoms to be aware of. When someone is experiencing these, it can give us important clues about what's going on. The key is to recognize these early so we can respond appropriately. Common signs might include changes in behavior, physical discomfort, or visible distress. For example, they might seem confused, unusually anxious, or exhibit physical signs like sweating or trembling. Recognizing these symptoms connects directly to our overall goal: early detection and effective response. Being alert to these signs helps us support those in need and potentially prevent escalation. So, understanding and identifying these symptoms is a crucial part of the overall safety and care process we're discussing today. Let's talk about HIV testing and screening. These are crucial tools in our efforts to identify HIV early and prevent its spread. Testing allows individuals to learn their status confidentially and accurately. Screening, on the other hand, helps us identify those at higher risk who may benefit from more targeted testing. It's important to understand that regular testing is recommended for anyone with risk factors, even if they feel healthy. Early detection through testing not only improves health outcomes for those who are positive, but also plays a vital role in reducing transmission within the community. Connecting this to the overall theme, effective testing and screening are foundational components of a comprehensive HIV prevention strategy. They empower individuals with knowledge and enable timely intervention, ultimately helping us move closer to controlling and eventually ending the HIV epidemic. Now, let's talk about the different types of HIV tests, starting with antibody tests. These are the most common and look for HIV antibodies, which are proteins your immune system produces to fight the virus. Most rapid tests and self-tests fall into this category, making it easier and quicker to get results. Next, we have antigen-antibody combination tests, often called combo tests. These are a bit more advanced because they check for both HIV antibodies and a specific protein called P24 antigen. The P24 antigen appears earlier than antibodies, so these tests can detect HIV sooner after exposure. Finally, there are nucleic acid tests, or NATs, also known as viral load tests. These are the most sensitive because they actually look for the presence of the virus itself in the blood. They're usually used in specific situations, like confirming a diagnosis or monitoring treatment. Understanding these different tests helps us see how early and accurately HIV can be detected, which is key to managing the virus effectively and preventing further transmission. Now, let's take a closer look at the stages of HIV. First up is stage 1, which is known as acute HIV infection. This is the earliest stage, and it typically occurs within 2 to 4 weeks after someone has been infected. During this time, the virus is rapidly multiplying, and the person might experience flu-like symptoms, though some might not notice any symptoms at all. It's a critical period because the virus is highly active and highly contagious. Moving on to stage 2, the asymptomatic HIV phase. At this stage, the virus is still present in the body, but it's usually not causing any noticeable symptoms. People can feel completely healthy, which can sometimes lead to a false sense of security. However, the virus continues to damage the immune system gradually, so regular testing and medical care are essential even if you feel fine. Finally, we have stage 3, the symptomatic HIV phase. Here, the immune system has become significantly weakened, and symptoms start to appear. These can include fatigue, weight loss, fever, and infections that don't go away easily. Recognizing these symptoms early and starting treatment is vital to prevent the progression to AIDS. Understanding these stages helps us see how HIV affects the body over time and underscores the importance of early detection and ongoing treatment. This knowledge is key to managing the virus and maintaining health. Now, let's talk about stage 4 of HIV, which is known as acquired immunodeficiency syndrome, or AIDS. At this stage, the immune system has become significantly weakened. This means that opportunistic infections and certain cancers, which the body would normally be able to fend off, become much more likely to occur. These are the infections and cancers that define the progression to AIDS. A diagnosis of AIDS is made when a person with HIV has a CD4 plus T cell count below 200 cells per cubic millimeter of blood, or if they develop an AIDS-defining illness. This threshold indicates a severely compromised immune system, making the body vulnerable to illnesses it would typically fight off easily. Understanding this stage is crucial because it highlights the importance of early detection and treatment of HIV, which can help prevent progression to AIDS and keep the immune system stronger for longer. Remember, the overall goal is to intervene early and maintain health before reaching this advanced stage. Let's take a look at code search for HIV. This is a crucial part of our overall strategy because it helps us identify and locate HIV-related genetic sequences more efficiently. By developing specialized search algorithms, we can quickly find relevant data within vast genomic databases. This not only accelerates research, but also improves our ability to track mutations and understand the virus better. The key here is that effective code search tools enable us to sift through enormous amounts of information rapidly, which is essential in responding to the evolving landscape of HIV. Connecting this to our broader theme, it highlights how technological innovations, like advanced search methods, are transforming how we approach disease research and ultimately, how we work towards better treatment and prevention options. When coding for HIV, it's important to only include confirmed cases. But here's a key point. In this context, confirmation doesn't necessarily mean we need documented positive serology or culture results. Essentially, if the case is confirmed clinically or based on other reliable information, we can code it accordingly. Now, regarding the selection or sequencing of HIV codes, we need to be precise. For asymptomatic HIV, we use the code Z21. This should be applied when a patient is listed as HIV positive but shows no documented symptoms. It's important to differentiate this from symptomatic cases to ensure accurate coding. For symptomatic HIV, the code B20 is used. This indicates that the patient has clinical signs or symptoms associated with HIV infection. Similarly, for AIDS, we also use B20 since it's classified under that code. Overall, these guidelines help us accurately reflect the patient's condition in our coding, which is crucial for proper documentation, reporting, and ultimately for patient care. When a patient is admitted for an HIV-related condition, the primary diagnosis we assign should be B20, which stands for human immunodeficiency virus disease. This means that HIV itself is the main reason for the hospital stay or treatment. Additionally, we need to include all other HIV-related conditions the patient has in our coding. These are listed as secondary diagnoses and help provide a complete picture of the patient's health situation. This approach ensures that the medical record accurately reflects the patient's overall condition, which is especially important for treatment planning and proper reporting. Remember, the key point here is that B20 is always the principal diagnosis when HIV is the main reason for admission, and all other HIV-related issues are documented with their own codes. This ties into our overall theme of accurate coding and documentation, which supports quality care and proper reimbursement. Let's talk about the coding guidelines when a patient with HIV disease is admitted for an unrelated condition. In these situations, the key point is to code the unrelated condition first, such as a traumatic injury, and then follow it with the HIV code, which is B20. This helps ensure that the primary reason for admission is accurately captured. Another important aspect is to determine whether the patient is newly diagnosed with HIV. If they are, it might influence how we document and code their condition. Remember, the main goal here is to accurately reflect the patient's clinical picture and ensure proper coding for billing and reporting purposes. So, whether the patient is newly diagnosed or not, always start with the unrelated primary condition and then include the HIV code. This approach maintains consistency and clarity in coding, aligning with the overall guidelines we've been discussing. Let's talk about some important coding guidelines for HIV. When a patient has inconclusive HIV serology, the correct code to use is R75. This indicates that the test results are not definitive. Now, if a patient has a previously diagnosed HIV-related illness, it's essential to code that with B20. This is the standard code for an established HIV infection. It's also crucial to remember that in these cases, you should never code with R75 or Z21. Using the correct codes helps ensure accurate documentation and proper tracking of HIV cases. These guidelines are part of the broader effort to improve coding accuracy and patient record clarity, which ties back to our overall theme of precise and consistent documentation in healthcare. Now, let's talk about the coding guidelines related to HIV infection during pregnancy and childbirth. When a patient is admitted because of an HIV-related illness during pregnancy, childbirth, or the puerperium, it's important to assign the correct diagnosis codes. The principal diagnosis code in this situation should be 0987, which indicates human immunodeficiency or HIV disease complicating pregnancy, childbirth, and the puerperium. Following that, you should include the B20 code, which specifically identifies HIV disease. Remember, this sequence helps ensure that the documentation accurately reflects the patient's condition and the specific circumstances during pregnancy and delivery. Recognizing and applying these codes correctly is crucial for proper reporting and treatment planning. This approach ties into the overall theme of our presentation. Accurate coding is vital for quality data collection, resource allocation, and patient care management, especially in complex cases like HIV during pregnancy. When we encounter patients with asymptomatic HIV infection who are admitted or presenting for a healthcare encounter during pregnancy, childbirth, or the puerperium, it's important to accurately document their status. For these cases, we should use the codes 0987 and Z21. These codes help ensure proper recording and facilitate appropriate care and follow-up. In addition, patient counseling plays a critical role. The code Z717 is used to indicate that counseling has taken place. This emphasizes the importance of providing education and support to patients regarding their HIV status and related health considerations. Furthermore, patient screening is also essential, especially in pregnancy-related contexts. The appropriate code here is Z114, which signifies screening for HIV. Regular screening helps us identify infections early, even in asymptomatic patients, allowing for timely intervention. Overall, these codes, 0987, Z21, Z717, and Z114, are vital for comprehensive care and accurate documentation, ensuring we address both the medical and counseling needs of our patients throughout pregnancy and postpartum periods. Today, I want to introduce you to sepsis, a serious and potentially life-threatening condition. Sepsis is essentially the body's extreme response to an infection. Normally, when our body fights an infection, it releases chemicals into the bloodstream to help combat it. But in the case of sepsis, these chemicals instead trigger an immune response that goes into overdrive. This overreaction can cause a cascade of changes throughout the body, damaging multiple organ systems. Sometimes, this can lead to organ failure or even death. It's important to understand that sepsis can develop from infections that you already have, like a lung infection, a urinary tract infection, or even skin or genitourinary infections. The key point here is that sepsis is not contagious. It cannot be caught from someone else. Instead, it's triggered by your own body's response to an infection. So, when we talk about the spread of sepsis, what we mean is that it originates from your own infection, not from outside sources. Recognizing the early signs and understanding how it develops is crucial because sepsis can escalate quickly and requires prompt treatment to prevent severe outcomes. Now, let's talk about non-infectious SIRS. Systemic Inflammatory Response Syndrome, or SIRS, is essentially an exaggerated defense reaction by the body. It can be triggered by a variety of noxious stresses such as infection, trauma, surgery, or even acute inflammation. It can also result from ischemia, reperfusion injuries, or malignancies, among other causes. What's important to understand here is that SIRS represents a widespread inflammatory response, not necessarily caused by infection. When SIRS is caused by a suspected infection, we refer to it as sepsis. But to confirm sepsis, positive cultures are mandatory, meaning we need microbiological evidence that an infection is actually present. This distinction is crucial because it guides how we approach diagnosis and treatment. Recognizing when SIRS is infectious versus non-infectious helps us tailor our interventions effectively and avoid unnecessary antibiotics if the cause is non-infectious. So, understanding these key concepts is vital in managing critically ill patients and improving outcomes across the board. Now, let's take a closer look at the different types of sepsis. First, we have severe sepsis. This occurs when sepsis progresses to involve one or more end organs failing. It's a serious escalation because the body's response is not just systemic infection, but also significant organ damage. Recognizing severe sepsis is crucial because it indicates that the infection is causing widespread harm and requires urgent intervention. Moving on, we have septic shock. This is a more critical stage, where despite repleting the intravascular volume, meaning giving fluids to support blood pressure, the patient remains hemodynamically unstable. In simpler terms, their circulatory system can't maintain proper blood flow. To put it plainly, septic shock is essentially severe sepsis plus circulatory failure. It's a point where the body's inability to circulate blood effectively becomes life-threatening, and prompt, aggressive treatment is essential. Understanding these distinctions helps us see the progression of sepsis and emphasizes the importance of early detection and management at each stage. Recognizing when sepsis has advanced to severe sepsis or septic shock allows us to tailor our interventions and hopefully improve patient outcomes. Let's walk through this flow chart of SIRS, or Systemic Inflammatory Response Syndrome. As you can see, it starts with the core concept, SIRS itself, which can occur with or without acute organ failure. Now, when SIRS is caused by an infection, that's infectious, it can progress to more severe conditions. Conversely, non-infectious causes can also trigger SIRS, leading to similar pathways. If we look at the branch with acute organ failure, we see that SIRS can escalate into severe sepsis. This is identified by codes like A40 or A41, and the R6520 code, which indicates sepsis without organ failure, but still significant systemic response. When the sepsis involves acute circulatory failure, meaning blood pressure drops dangerously low or circulation is compromised, it progresses further into septic shock. This is marked by codes like A40 or A41 again, and R6521, which signals the presence of acute organ failure. The key takeaway here is how SIRS, depending on its cause and progression, can escalate from a systemic inflammatory response to severe sepsis, and then to septic shock. Recognizing these stages is crucial for timely intervention and improving patient outcomes. This flowchart visually emphasizes the importance of early detection and understanding the pathways that lead to these critical conditions. When documenting sepsis, if the specific type of infection or the causal organism isn't further specified, it's important to assign code A419, which stands for sepsis, unspecified organism. This helps ensure consistency and accuracy in coding when details are limited. However, if the patient has severe sepsis or there's an associated acute organ dysfunction, then a code from subcategory R65-2 should be used. But it's crucial to remember that you shouldn't assign this code unless those more severe conditions are actually documented. Now, regarding the term urospsis, it's a common term, but it's considered nonspecific. That means we need to be cautious and seek clarification if possible. Proper documentation is key to accurate coding, especially when it comes to terms like urospsis that can be somewhat vague. Overall, these guidelines help us communicate clearly and accurately about the patient's condition, supporting proper treatment and billing. Let's go over the coding guidelines for sepsis. When coding severe sepsis, you need to assign at least 2 codes. First, you identify the underlying systemic infection, and then you add a code from subcategory R6520, which indicates severe sepsis. If the specific organism isn't mentioned in the documentation, you should assign a code for sepsis of an unspecified organism. For example, if there's sepsis due to Pseudomonas along with acute hepatic failure, the correct codes would be A4152 for Pseudomonas sepsis, R6520 for severe sepsis, and K7200 for acute hepatic failure. Similarly, if you have sepsis caused by E. coli with acute respiratory failure, you'd follow the same approach. First, the organism-specific code, then the severe sepsis code, and add any organ failure codes as needed. Now, when it comes to septic shock, the coding reflects that it's severe sepsis with circulatory failure. You start with a code from the A40 or A41 category, then add R6521 to specify circulatory failure, and include any other acute organ failure codes that are present. The key takeaway here is understanding the sequencing. Identify the infection first, then specify the severity and organ failures involved. This ensures accurate and comprehensive coding for sepsis cases. When coding for sepsis due to a post-procedural infection, it's important to start with the correct primary code that identifies the site of infection. If the infection follows a wound from a procedure, you should use codes from T8141 to T8143, which specify infection following a procedure. Alternatively, if it's related to an obstetric procedure, codes 08600 to 08603 are appropriate. The key here is that the site of the infection must be identified first, so make sure to code that initial infection accurately. Next, you need to assign an additional code that indicates the sepsis itself. For example, T8144 is used for sepsis following a procedure, and 08604 is for sepsis following an obstetric procedure. Remember, it's also crucial to identify the infectious agent causing the sepsis, so always include an additional code for that as well. Now, if the patient's condition is more severe and they develop severe sepsis, then you should assign a code from R652, which captures severe sepsis. After that, you need to specify the organ dysfunction involved, since that's critical for capturing the full clinical picture. Overall, these guidelines help us ensure that our coding accurately reflects the clinical situation, which is essential for proper documentation, treatment, and data analysis. This approach aligns with our overall goal of precise and comprehensive coding practices. Let's take a closer look at COVID-19, a disease that has significantly impacted global health. First, we'll go over its introduction, what it is and how it emerged. Then, we'll discuss how it spreads, primarily through respiratory droplets when people cough, sneeze, or talk. Understanding the spread helps us see why prevention measures are so important. Next, we'll explore the pathophysiology, which is how the virus affects our bodies, particularly how it targets the respiratory system and can lead to severe illness. Moving on, testing is a crucial component, covering the different types of tests available, like PCR and rapid antigen tests, and their roles in diagnosis and controlling outbreaks. We'll also review the signs and symptoms, which range from mild ones like fever and cough to severe complications like difficulty breathing. Recognizing these symptoms early is vital for timely treatment. Speaking of treatment, we'll discuss current approaches, including supportive care and some of the medications used, although there's still ongoing research. All these points tie back to our overall theme of understanding infectious diseases and how we can better protect ourselves and others through knowledge and appropriate action. Pathophysiology. Coronavirus disease is caused by the SARS-CoV-2 virus. This virus primarily affects the respiratory system, leading to a range of illness severities. People who are affected can experience anything from mild symptoms to more moderate forms of the disease. The good news is, many individuals recover, whether they are hospitalized or not. However, it's important to note that older adults and those with underlying health conditions tend to experience symptoms that are more intense and potentially more dangerous. As we discuss the signs and symptoms, you'll see how these reflect the body's response to the virus. Common signs include cold and cough, which are typical respiratory symptoms. Many also experience flu-like symptoms, such as fatigue, body aches, and chills. Fever is quite common and often one of the first indicators. Additionally, some people notice a loss of taste and smell, which has become a distinctive feature of COVID-19. Recognizing these symptoms early is crucial because it helps in timely diagnosis and management. Connecting this to the overall theme, understanding how the virus affects the body and the range of symptoms helps us appreciate the importance of prevention, early detection, and proper care. Now, let's talk about how COVID can be tested using the RT-PCR test. This is a really important tool in our fight against the virus. A PCR, or polymerase chain reaction test, is designed to detect the genetic material, either DNA or RNA of the virus. So, when someone is tested, a sample is taken from either a body fluid like blood, or more commonly, a swab from inside the nose or throat. Once the sample is collected, scientists use PCR to make many copies of the virus's genetic material. This process is called amplification. Essentially, it allows us to take a tiny amount of genetic material and multiply it exponentially so we can detect even very small amounts of the virus. This method is highly sensitive and specific, making it one of the most reliable ways to diagnose COVID-19. Connecting this to our overall theme, it highlights how advanced testing methods are vital in identifying cases quickly and accurately, which is crucial for controlling the spread of the virus. Let's talk about the guidelines for coding COVID-19. First, it's important to only code confirmed cases of the novel coronavirus disease, COVID-19, as documented by the provider. When a diagnosis is confirmed, we assign code U071. Now, if the provider documents that the patient is suspected, possible, probable, or if the diagnosis is inconclusive, we don't assign U071. Instead, in those cases, we code the signs and symptoms that are reported. Another key point is about sequencing the codes. If COVID-19 is the principal diagnosis, that is, the main reason for the visit or hospitalization, then we code U071 first. After that, we add any relevant codes for associated manifestations, whether they are respiratory or non-respiratory. These guidelines help ensure we're accurately capturing the confirmed cases and properly sequencing the codes, which is crucial for data accuracy and billing. Remember, the focus should always be on confirming the diagnosis before coding it as COVID-19. When a patient is admitted primarily because of a respiratory issue related to COVID-19, such as pneumonia, the key point is to assign code U071, which is for COVID-19, as the principal or first listed diagnosis. Then, you add the specific code for the respiratory manifestation, like pneumonia due to COVID-19, which is J1282. This approach helps clearly identify both the underlying cause and the specific respiratory problem. Now, if the patient is admitted for a non-respiratory issue that's caused by COVID-19, such as viral enteritis, the protocol is similar. You still assign U071 as the main diagnosis, but then you include the code for the non-respiratory manifestation as an additional diagnosis. This method ensures that all relevant details are captured accurately, which is important for both clinical documentation and statistical purposes. Connecting this to our overall theme, understanding how to correctly code these different manifestations of COVID-19 helps ensure proper documentation, billing, and tracking of the disease's impact across various health conditions. It's essential to distinguish between respiratory and non-respiratory manifestations to reflect the true clinical picture. Let's talk about exposure to COVID-19. When an individual is asymptomatic but has had actual or suspected exposure, we assign the code Z2822. This helps us track potential cases even if they aren't showing symptoms yet. Next, for screening purposes, especially before procedures like surgery, we use the code Z1152. This indicates that the patient is being tested proactively to identify COVID-19 before any clinical signs appear. Now, sometimes patients present with signs or symptoms that could be related to COVID-19, like fever or cough, but we haven't confirmed a diagnosis yet. In those situations, we assign the appropriate codes for each of the signs and symptoms. This ensures we're accurately documenting what we're observing. And here's an important point. If a patient shows symptoms and also has had contact with someone suspected or confirmed to have COVID-19, we add the code Z2822 to indicate that exposure or contact. This helps paint a complete picture of their situation for both clinical and public health purposes. All of these coding distinctions are crucial because they help us accurately capture and communicate the patient's COVID-19 status, which is essential for proper treatment, reporting, and tracking the spread of the virus. Let's walk through an example to clarify how we code these situations. Suppose a patient comes in with a fever and an acute cough after being exposed to COVID. In this case, We would assign the codes R59 for fever and R051 for acute cough, along with Z2822 to indicate the exposure to COVID. Now, for patients with a personal history of COVID-19, we use the code Z8616. This helps document that they've had COVID-19 before, which is important for their medical record. When it comes to follow-up visits after COVID-19 has resolved, if the patient has no residual symptoms or conditions, and their COVID-19 test results are negative, we assign Z09 to indicate a follow-up exam, plus Z8616 for their history of COVID-19. This ensures we're accurately capturing the reason for the visit. Lastly, for post-COVID conditions, meaning sequelae or symptoms that develop after the initial infection, we first code the specific symptoms or conditions, then add U099 to specify the post-COVID condition. This approach helps us document ongoing or new health issues related to the previous infection. These coding distinctions are essential for accurate documentation, billing, and understanding the patient's health journey with COVID-19. Now, let's look at some important codes related to underimmunization. The code Z28310 refers to individuals who are unvaccinated for COVID-19 infection. This highlights cases where people haven't received the COVID-19 vaccine at all. On the other hand, Z38311 covers those who are partially vaccinated for COVID-19. This means they've started the vaccination process, but haven't completed the full series. These distinctions are crucial because they help us understand different levels of immunity in the population. Recognizing these categories allows healthcare providers to identify who may still be vulnerable and needs targeted outreach. Throughout this presentation, we've emphasized the importance of full vaccination to ensure maximum protection. So, understanding these codes helps us better track immunization's status and address gaps in coverage.